Welcome back to the Dr. Lora Shahine channel, your trusted source for reproductive health and wellness insights. Today, we are breaking down common and uncommon symptoms of PCOS or Polycystic Ovarian Syndrome. This is a common condition that affects millions of women around the globe, but yet there's still so much we need to understand. So let's get started. I'm Dr. Lora Shahine. I'm a double board certified OBGYN and reproductive endocrinologist, helping people build families and diagnose and treat PCOS for over 20 years. I love educating. If this is your first time finding this channel, welcome. Be sure and subscribe so you don't miss my weekly videos all about reproductive health. And if you're coming back, welcome back, especially if you're learning about PCOS. I have a whole playlist here where I have some more videos just about PCOS. There are two other ways to stay in touch and get more educational content from me. Number one, my weekly Baby or Bust Fertility podcast. You can listen anywhere you listen to podcasts. It's interviews with experts and fertility warriors and some solo in-depth episodes all about education. The second way is my weekly newsletter. You can sign up to get information, news about fertility and the media, and my weekly content and some suggestions and recommendations for products and books that I recommend for you. Now, today we are breaking down PCOS symptoms. PCOS, Polycystic Ovarian Syndrome, is so common, yet we still have so much to learn and understand about this condition. We're going to go over four main topics. Topic number one, we're going to review exactly what PCOS is. Topic number two, we're going to go over common symptoms that can help you figure out if you might have PCOS. Topic number three, we're going to go over uncommon symptoms that can be related to PCOS and can hopefully put together information and help. It might make it click and make you say like, oh my gosh, that explains why I'm having these symptoms. I'm so glad I understand now. And topic number four, I'm going to give you tips on what to do next if you think you have PCOS. Now stick around to the end of the video where I go over really important questions to ask your doctor to help you advocate for your care. Topic number one, what is PCOS? Polycystic Ovarian Syndrome is a common hormonal disorder impacting at least 10% of women around the globe. It is so common, but it's so easy to go misdiagnosed and undiagnosed for years. So PCOS stands for Polycystic Ovarian Syndrome. And first of all, the name should be changed because you hear the word cyst and it's just red flag. Immediately, people are like, oh my gosh, I have cysts in my body. There's got to be something wrong. Really, we should call it polyfollicular syndrome or polyegg syndrome because basically your ovaries are full of these little fluid collections called follicles that hold eggs. And in someone who has PCOS, they usually have more follicles in their ovaries than somebody without PCOS. So a fluid-filled structure in the body is technically a cyst. It's a medical term. But someone with PCOS, they're worried that they've just got these huge cysts in their ovaries, but really it's just multiple little follicles, and it's just more follicles or more eggs than you would typically see at someone for about their age. So for example, a lot of times people will get an ultrasound to look at the ovaries for lots of different reasons. And typically an average antral follicle count or count of the little follicles is about 10 to 15 between both ovaries. Someone has more than 20, more than 25, or their ovaries are enlarged, like bigger than the average 2 to 3 centimeters. This can be an ultrasound indication that this person might have PCOS. You cannot be diagnosed based on just ultrasound findings. It's a collection of signs and symptoms, but this is where the name comes from. This PCOS can be associated with a lot of different, immediate impacts like irregular cycles, irregular ovulation, sometimes difficulty conceiving, or long-term health issues like insulin resistance, diabetes, metabolic disorders. So it's such an important diagnosis or condition to realize that you have as early as you can, because if you can make lifestyle changes, it can impact your overall health for the rest of your life. So it's really important to figure out if you've got PCOS and learn a lot about this condition if you do have it. Topic number two, common symptoms of PCOS. Now I can think of 8 common symptoms, and I want to share them with you. Symptom number one, irregular periods. This is one of the reasons that people often get diagnosed, especially in my clinic where people are trying to conceive. They're learning from my other videos how to track ovulation and learning what normal or typical menstrual periods are like. And they say, wait, my girlfriends or my friends are having a period about once a month, but I could maybe go for 40 days, maybe go for a couple of months. Sometimes people can go for 6 months to a year without a period. Periods can be very irregular. And one of the reasons that people can have irregular periods is PCOS. It's not the only reason, but this is something that shows up. It's a pretty common presentation for PCOS. It's one of the most common ways that people get their diagnosis because the doctor will do tests to figure out if there's any other reason that they're not ovulating regularly. Remember, you have to have a regular ovulation in order to have regular, predictable periods. And in that evaluation, they can say, hey, the reason that you're having irregular periods is because of irregular ovulation, because of PCOS. Symptom number two, hirsutism. This means excessive hair growth, and this is because of the elevated levels of androgens or male hormones in the setting of PCOS. So everybody has male and female hormones. Women have testosterone, they have other androgens, and in PCOS, there's a little bit of an imbalance. So there's more male hormones, and that can show up in different ways. And one of them can be hirsutism, and that means like thick hairs, thick, dark hairs, usually in the central part of your body, like chin, mustache, in between the breasts, kind of along the midline, like towards the navel, between the thighs. So kind of a male pattern, androgen heavy, testosterone heavy pattern of hair growth can be one of the clues, one of the symptoms, common symptoms of PCOS. Of course, there's other reasons that people can have this presentation or this hair growth, but it's something to consider if you're thinking you might have PCOS. Symptom number three, acne or oily skin. So of course, there's other reasons that people can get acne and oily skin, but this can be a common presentation of PCOS. Symptom number four, thinning hair or hair loss in a male pattern. So again, this is from the high levels of androgens. We talked about the thicker hair, we talked about the acne, but you can also have thinning hair, especially in typical male pattern. Like right here at the crown of the head, if you think about guys, going bald, they often go bald here, or thinning here at the hairline, like a receding hairline. That can all be due to these excess androgens or an imbalance, an increase of male hormones compared to female hormones. Symptom number five, weight gain. So this does not present in every patient with PCOS, but often people with PCOS will be at a heavier weight, even though they feel like they're watching their diet, they're exercising the same way, but they just keep gaining weight, especially centrally, kind of like in the abdomen. It sort of deposits there. And a lot of this is from insulin resistance. So PCOS is a metabolic condition. And when your insulin isn't working as well, you're having higher levels of blood sugar. And one of the things that can happen is the collection of adipose tissue or fat tissue, especially in the central portion of the body. And remember, not everybody with PCOS will struggle with their weight. Not everybody who is struggling with their weight has PCOS. This is very individualized, and it's triggering when I talk about weight and PCOS because so many patients with PCOS have been sort of dismissed by their doctors or healthcare providers saying like, oh, just lose weight and your symptoms will get better. So it's really, really frustrating because there is a balance. I have definitely have patients that can say, oh my gosh, when I go up 10 pounds, all of a sudden my periods get more irregular. I start having more acne that tips over my body into this really insulin resistant state because the pancreas is having a hard time keeping up with the demands at an elevated weight or set point in the body. And so they'll start having more PCOS symptoms. And then they say, but when I lose those 10 pounds, things just get better. I start ovulating on a more regular basis. I start having more periods. So there is some logic, rationale to healthcare providers saying it, but it's usually kind of received or can sometimes even be said in a pretty negative way, like, oh my gosh, just restrict your calories and just exercise more and your PCOS will get better. It is just not that simple. It is really, really not the right thing to say to someone with PCOS that all they have to do is lose weight. This is a metabolic condition. This is insulin resistance. This is this person's body. And it is something that should be discussed holistically in a kind way and explain sort of the mechanics and the metabolism. But just to dismissively say, oh, yeah, lose weight and everything will be fine, that's not okay. And also, sometimes people get misdiagnosed because they're thin. There's, some people that have PCOS, they have all the other symptoms, but they just are in a body that, appears to be thin. And so the doctor or healthcare provider will kind of misdiagnose because they were taught, oh, it's only associated with people that are struggling with their weight. So weight and PCOS are definitely linked, but everybody's body is unique. Every patient is unique. And it should be discussed with education and kindness and awareness, and realize that not everybody is the same. Symptom number 6, fertility issues. Now listen, PCOS and infertility are often linked when people get the diagnosis or they're reading about it online. And absolutely, a lot of my patients who are struggling to build their family can be diagnosed with PCOS, but a lot of people with PCOS will not have difficulty getting pregnant. It is not an absolute, like, if you have PCOS, you have to do IVF, or if you have PCOS, you're absolutely going to be infertile. I've actually got a great video here and educational content in my PCOS playlist that talks about PCOS and IVF and how it's a common misconception that the only way somebody can have a baby if they have PCOS is IVF. So if you're curious about that, find that video. I think that the association with infertility is often associated with irregular ovulation. And so people with PCOS who are only ovulating 3 or 4 times a year, of course, it's going to take them longer to conceive because they're not having as many chances as somebody that ovulates 12 or 13 times a year. And it's hard to time trying and sort of be, active and figure out, the maximum time in the cycle to try to conceive if you are not having regular cycles. And so that could be a link to it. Of course, there's many, fertility is multifactorial. There's so many things that can be going on. It is a common symptom, meaning it's a common way that people can get diagnosed, like they're trying to conceive, they're having irregular cycles or not, but they get diagnosed with PCOS with the fertility doctor like me. And so it's just a common association, but not everybody with PCOS will be infertile. Symptom number 7, dark patches of skin. This is called acanthosis nigrans, and it's due to insulin resistance and a deposit of material kind of in the skin. It's usually kind of on the back of the shoulders or in between the thighs. It can often be diagnosed by dermatologists, or if someone is doing a physical exam and sees this, they might say, oh, this could be related to insulin resistance, could be related to diabetes. And if you're also diagnosed with PCOS, it kind of all comes in and is linked in together. Of course, not everybody with PCOS will have this presentation, but it is a common symptom. Symptom number 8, a lot of people don't talk about this, but PCOS can be associated with fatigue and just being really tired. A lot of this is insulin resistance. A lot of it could be due to mental health strain, frustration if you're trying to conceive and having irregular cycles, trying to figure out what's going on with your body. Maybe you're going to the doctor and you're feeling dismissed or feeling like they're not paying attention to you, just telling you to lose weight. There can be a lot of frustration, emotional challenges, fatigue, kind of overwhelm. That's why it's so important to get a correct diagnosis, find a provider that is listening to you, will work with you long-term, and to really take care of your emotional health, your mental health, and really good self-care, but that underlying fatigue, really, really common. Topic number 3, some less common symptoms that can be associated with PCOS. I'm just going to list these out for you. Pelvic pain, headaches, sleep disturbances, especially sleep apnea. PCOS can look really different for everyone. These are some less common symptoms, but they can definitely show up and they can be associated with PCOS. Let me say them again. Pelvic pain, headaches, and sleep disturbances like sleep apnea. Topic number 4, if you think you have PCOS, what do you do next? I recommend talking to your healthcare provider and finding a doctor that is going to listen to you, validate you, and you can expect to run some tests, most likely blood work, most likely an ultrasound, and a follow-up visit where you can kind of go over if you have the diagnosis, maybe something else comes up. Maybe it's a thyroid issue, maybe it's a prolactin issue. You really want to make sure that you have the right diagnosis, and you want to have a thorough discussion about what the next steps could be. The treatment really depends on whether you're trying to get pregnant or not get pregnant, because treatment options can vary. The treatment options also depend on what your symptoms are. So somebody with PCOS could just be presenting with thicker hairs and hirsutism or acne, but they're having perfectly regular, predictable menstrual cycles. So what you're presenting with can really determine what the next steps are, but you can have a thorough discussion with the doctor who's going to take a good history. They were probably going to recommend some tests, and they're going to have a follow-up visit where they talk about different options. Now, the way to prepare for this visit is to be very direct when you meet the doctor. A lot of times people talk about like, gosh, I just felt so rushed. The doctor only spent 10 minutes with me. I mean, the healthcare system is just pretty frustrating. And so really have an intention and a goal with this visit. Like when you go there, say, I am here because I think I have PCOS. Write down the symptoms that you have. Say, I'm having irregular periods. I've got acne. My family, my sister, my mom had PCOS. It can sometimes run in families. Think about why you think you might have PCOS and say, I want to do testing to figure this out. And I want to have a follow-up visit with you to go over the test results and talk about the treatment. And be really direct with the doctor and say, hey, is this something that you feel comfortable caring for long-term? Or do you have a recommendation for a colleague in the area that might really focus on PCOS? Because not every primary care provider, not every OBGYN is going to really understand and sort of think about PCOS holistically. But that first visit can really be direct. This is why I'm here. These are the symptoms that I'm having. Let's do some testing, and then let's talk about what the next steps could be. And that will make the visit efficient and much more valuable for you. And I really hope that that helps. I'm glad you stuck around to the end of the video. I want to give you 3 specific questions to ask your provider to make sure you advocate for your care. Question number 1, what tests are we going to do to confirm a diagnosis of PCOS? Or maybe something else, like just be really clear, like what tests are we going to do? Question number 2, how are we going to get the results of these tests? Are we going to have another visit where we go over them? Is your nurse going to call me? Do I have a portal that I look at? Like, how are we going to get these results? And that leads into the next question, question number 3. What are we going to do as a next step, like as far as treatment options? When we get the diagnosis, are you going to manage me, or should we maybe consider a referral to a PCOS specialist, a colleague that really focuses on this for long-term care? So those questions, what tests are we going to do? How am I going to get those results? And that leads into what is the next step after that? If I get the diagnosis, what are we going to do? Are you going to manage it, or am I going to go to a different provider that specializes in it? This very direct kind of 3 questions and being prepared for that visit is going to decrease your frustration. It's going to make it a more valuable visit, and you're going to waste less time. And I hope that's helpful. Actually, I hope this whole video was helpful. Like this video if you learned something, comment with questions that you have. Be sure and subscribe to this channel so you get my weekly videos all about reproductive health, and see the PCOS playlist where I have multiple videos talking about PCOS and fertility, diagnosis, PCOS and IVF. I really hope that this is helpful. And until next week, wishing you love, luck, and pineapples.